All right, guys, I hope you've been enjoying the next series here. If you've missed the last 4, look at the last 4 or look at the links in the description. Now we're going to go a little more in depth with the upper trap of how it can be affected in different ways. Now, this is more of how to look at things differently and how to try things differently. So if it works, that's great. So we're going to talk more about how the rib cage and the collarbone or upper trap has a relationship to it. So if you are a person that notices and you're trying to do the shrug and it doesn't seem to help so much, maybe your rib bones here are kind of stuck together or moving together with the shrug. So for example, this rib bone pops up and pushes onto the collarbone and goes up versus the rib bone staying neutral as you bring the shoulder blade up or the collarbone up. So maybe you kind of do this. So see how I puff my chest up to lift it up. And that could lead to this kind of compression in this area, which it also affects your neck to be possibly tight. So we're going to go to the anatomy again, how it relates to each other, and then we'll do a simple cue to possibly open that up more. So I'll see you in the video. Hi, this is Kento at Kamiyama Physical Therapy. Welcome to our channel. So we have the upper trapezius muscle that we discussed in our last video. Excuse me, this is the upper trapezius, right? So this brings that shoulder blade up and upward rotating. Now, I want to discuss about the chances of how things happen. So these are the scaly muscles. And these are neck muscles that has an effect on your rib bones, hence your breathing. So when you inhale strong with your breath, it could happen. So if you can take a look here, the rib bones, the 1 and 2 has an attachment to the scaling, or the scaling muscles have attachment to these 2 bones. So when you breathe in, these rib bones from the second over here can move up during inhale. It can pull up that way. And if you kind of see, it can pull up in that fashion. What that it could do is it could assist or associate it going up with the collarbone. So when you breathe in too much, this chest goes up. The upper trapezius is not able to independently move from the rib bones. And that could be sometimes the hidden or what's making it difficult to progress in these cases. So this is just a way to look at it. This is a look at the anatomy, and I'll see you in some simple cues to possibly work on that. All right, now that you looked at the anatomy and how the scaling muscle attaches to the rib bone and can pull up and kind of mimic, if I just move from there, how to shrug a shoulder. When that happens, your rib cage is really pulling up the shoulder blade or the collarbone and not the upper trap itself. So what can we do about that? There's a couple of things we can try, and I'll give you 2. Pull the collarbone up from the outside, engage the upper trapezius muscle, and while keeping the upper collarbone up, or the collarbone up, breathe out. So if you notice my chest shrink a little as I keep my upper trap up. What am I doing with that? I'm just creating independence between the rib cage and the collarbone. Hopefully it's simple enough to try. Another way is you can do it vice versa of the protocol or sequence. You first breathe out. Keep the ribs down as you think about bringing the collarbone up. So you're just creating this cogwheel effect to each other so it works in a different way. So simple, just trying in different ways, and hope it makes sense to you all. I'll see you in a new video or a different video.